Bismillahirrahmanirrahim. Dear viewers, Assalamu alaikum. I am your host Faisal Raza and you are watching Foresight. Viewers, autism spectrum disorder, more than just a diagnosis, it's an entirely different way of experiencing the world. But what does it mean for a child, his or her family, the caregivers, teachers, and therapists living with autism every day? From understanding the early signs of autism to exploring the effectiveness of the early interventions, from navigating the challenges in the education arena, workplaces, in society, to shaping inclusive policies for the autistic individuals. This program delves deep into the realities of autism in Pakistan. How does early intervention actually shape the child's future? What's the critical and important role family has? Even the caregivers, the teachers, the therapists, and the society itself. What type of a role they can play or they are playing in developing social skills and relationships. Are the educational institutions and the workplace is fully geared up, equipped with modern technologies, and have a say to accept the neurodiverse individuals? Whether our policies protect and encourage those autistic individuals to be in society, in economics, or to have social and economic inclusion. To talk on these subject or this very important subject, and along with that, to get answers of these critical questions, we have in our studios Ms. Sadaf Arif. She is psychologist and applied behavioral analyst. Most welcome to you, ma'am. Thank you very much for your presence. With her, Ms. Irum Mumtaz. She is remedial therapist. Thank you very much, ma'am, for your presence here in the studios. Yes, and online joining us, Ms. Sabeen Bilal. She is autism behavioral analyst. Most welcome to you, ma'am. Thank you very much joining us online. My first question to you, Sadaf, what is actually autism disorder, autism spectrum disorder, and how is it characterized? Is it a neurodevelopmental condition or having challenges in social communication with repetitive behaviors and the sensory sensitivities, or what? What actually, if our viewers want to understand what actually autism is?
Autism is basically a neurodevelopmental disorder in which the child has deficit in mainly 3 areas, and that is socialization, communications, and they have repetitive and restrictive behaviors, restricted interest. And when we talk about how it is characterized as the deficit in social communication. They can't engage themselves in the social scenarios. They can't. They have repetitive behaviors. For example, rigidity in their routines, and they have, for example, non-verbal communication and poor verbal communication, absence of eye contact, and then they can have basically self-stimulatory behaviors, that is rocking all the time, hand flapping and stimming, finger wiggling like this, and all of these kind of things.
Your point well taken. Irum, what are some strategies for supporting individuals with autism in their daily lives? Whether family members and the caregivers have to apply some basics like simple communication, as Sadaf elaborated, social and behavioral support, some kind of a sensory management, maintaining a daily routine like emotional attachment, have relationships, and that help such child to actually return to the normal life. So how do you characterize overall, and what type of strategies actually can support an autistic individual?
First of all, we need to spread awareness about autism. What is autism? And all the stakeholders, starting from the people sitting in the helm of affairs, in the parliament, they also need to know what is autism and what sort of schooling these children require. Inclusion is the key word. And then the parents, they are, you know, like if you have an autistic child, it's a very traumatic experience for the parents. You know, parents are totally clueless. You know, unfortunately in our society, parents are never trained. Like a young girl or a boy, when they're getting married, okay, you will have children. So the milestones, the developmental milestones. So young mothers and fathers are totally clueless, you know, because had they been trained in advance that what are the developmental milestones, they would have immediately figured out that this child is different. He is not following the developmental milestones. So the problem starts from home. The parents are totally clueless, trial and error, and then if a couple lives in a joint family system, the grandmothers, the nannies and the dadis, they are always guiding the young couple how to deal with the problem. Usually it's hereditary, all right, the main cause. So if the parents are not aware, they don't know where to send their child to school. And coping with the child's problem. If a child is hyper, okay, it depends, it's a spectrum disorder. After assessment, we come to know the severity of the problem, whether it's mild, moderate or severe. So if a child is acting out, so the grandma might say in a joint family system, no, you were also like this. Let him be, he'll be fine. Because no one knows. By the age of 7, a child's strong and weak part, the character is developed. All the good and the bad.
They don't understand that a problem is actually piling up.
Yes, so everything is adding up. The frustration level of the parents, blame game, denial, any label attached to their child, they are not ready for that. Then the problem happens, further aggravates when they start looking for a school, because the schools are also totally clueless. They do write inclusive setup and all that, but there's hardly any inclusion in the schools. So the biggest thing which we need to do is to help out such children is spread awareness amongst all the stakeholders.
Definitely, that is very important. Very important.
Because only when we are aware that this child is different, and unfortunately in Pakistan we have got 2 sets of schools, for regular children, for special schools. So a borderline autistic child does not belong in a special school. That child has to go to a regular school.
Normal school, a regular school.
Yeah, so don't use the word normal because the stigma
mainstream
attached.
is the best word.
Definitely.
Mainstream is the best word.
So like they have to go to, and I have observed, it was really shocking, a very famous, I will not take the name of this institution, my friend was the principal and she called me, Irum, I have this student in our school and the teachers are unable to cope up with this. He's making these weird...
Your point well taken. Sadaf, what are the common symptoms of autism? At what stage or what age do they typically appear actually? And how the diagnosis and the causes to be determined actually in a child suffering from autism, and whether it's correct that if children with autism receive early intervention, they improve remarkably well, and many of them may go to the mainstream schools, and that would not be although the counseling and all other things are required with the passage of time, but they behave as a brilliant student might be in future. So how do you see that?
First of all, talking about the symptoms include the poor eye contact, no response to their name, and it can see whenever the child is 6 months old, he started giving the eye contact to the parents, and whenever he is avoiding the eye contact, that means that something is different with this child. And then the speech develop properly at the age.
Whether these symptoms aggravate with the passage of time or getting normalized?
It may be rise and fall.
Okay.
Maybe he can give eye contact at the age of 12 months, but then he stopped responding to his name, and then comes the main thing, which parents notice his speech. He is not speaking well. He doesn't have any other symptoms, but he is not speaking. Like the Miss Irum mentioned that grandmothers take it non-seriously, that your father is also like that, and symptoms are mostly suppressed by this kind of things. But when we talk about the pure symptoms, it's hand flapping and sensory problems. Either the child is hypersensitive.
Like this sensation, something like that?
Yeah, they have hypersensitivity or hyposensitivity, both. It can be on an extreme level. For example, they can underrate the pain or they can overrate the pain. They can underrate the voice, coming and covering their ears, or they can underrate that a minor sound can disturb him, even the sound of AC when we
Sometimes
switch
that
off.
sensation might be more intense.
Yeah, it can come in the form of meltdowns then. Yeah, for example, if they are in the mall and they seek that the some sound is not pleasant to their ears, then they starting meltdowns over there, and the parents couldn't understand the reason behind the meltdowns, and they couldn't even differentiate between the tantrums and the meltdowns.
Sometimes when there would be some sort of hyper issue, so they also might be having cry or
inappropriate cry, inappropriate laugh at sometimes, and they can be staring in the whole space, and anything that differentiate them from the normal.
that might be
excessive
unusual
jumping,
than a normal child.
yeah, excessive jumping and a
Your point-
disturbance of even a simple trigger, a weather can even stimulate their symptoms. It can aggravate their symptoms.
Might
at
be the
times.
thunder or something like
Exactly.
that. So, okay, your point well taken. Sabeen, how can a family or the caregiver support individuals with autism in developing social skills and relationships? Because to help individuals with autism develop social skills require structured support, some kind of practice and patience and encouragement as well. So in that, family members and caregivers can play a very vital role. So how do you see an individual who is suffering from autism and have a family and caregivers? So what they have to do actually?
Thank you for asking this question. Before I answer it, I just want to request that instead of us saying what are the symptoms of autism, because when you ask about symptoms, it sounds like it's a disease or a bimari, and this is a big problem in our society, that autism is viewed as a disease, whereas it's not. It's just differences. So these are just differences in individuals. So instead of calling it symptoms like it's some sort of a disease, I think it's better that we treat it as just a different way of thinking, of living, so that everyone is accepted. As far as creating social skills, so there are a number of ways that families can do it. First, family members can model social skills. Like when I work with kids, I always say, Assalamu alaikum, hello. And when the child imitates, you use positive reinforcement and you say, good job, you greeted me. So you're basically modeling the social skills. Then you can also use visual supports and social stories. You can read stories to the kids about different social skills. So these are just a few of the different ways that families can use different tools to support autistic children in building their social skills. And more importantly, I always encourage the parents we're working with that expose your children to different social scenarios. Take them to parks, arrange play dates for them, take them to malls, because you have to show them how to interact with society. So these are just a few of the ways that social skills can be built. And most importantly, families need to be patient, because with autistic kids, these skills do not develop overnight. So you have to be patient and loving and believe that the child can learn, and you'll see that the child will learn.
Your point well taken, Sabeen. Sabeen, what are some strategies for creating a supportive and autism-friendly home environment, like having structured routine, something like friendly spaces, some support communication as well, creating a sense of independence, engaging activities, emotional attachments, and also the safety and hygiene as well. So how we can create that environment at home?
That's a very good question. A lot of autistic individuals, they thrive on structured routines. So I always encourage parents that put up visual schedules. So a visual schedule, the child or the individual with autism can see what's going to happen in the day. So if you put up 9 a.m. breakfast time, 9:30 get ready for school, so the child doesn't get anxious because the child knows what is going to happen next. So you're creating a very safe, structured environment for the child. Also, then, like you mentioned, you can have a sensory room for the child at home. It doesn't need to be elaborate. It can just be a quiet space with minimal distractions with the child. If the child is feeling overwhelmed, the child can go there and just calm down a bit. As far as safety is concerned, a lot of kids with autism, they do not understand danger or safety. So we do encourage parents to have child locks in their house. जो sockets होते हैं, those should be covered, just to create a safe environment for the children. And as far as learning about hygiene, so behavior therapists are perfect to help kids learn these skills, but they can also be taught in the home environment. It's just like if you take a skill like changing clothes, so it just needs to be broken down into smaller components and then taught in smaller steps to the child. So these are just a few very simple ways that a home environment can be made very friendly for an autistic child, and how an autistic
Okay, your
child.
point well taken, Sabeen, your point well taken. Ma'am, what policies have we carved or legislations available for the individuals suffering from autism, whether their education and employment opportunities be tailored according to their needs, and have we the legally binding the entities to maintain such an environment at the educational institutions and at the workplace, different organizations, entities to take care of such individuals, or at least to have that environment available over there so that they can be independently work and have encouragement and confidence as well?
Unfortunately, this is the first time that Punjab government has opened the first government school for autistic children, autism support school in Lahore. So, you know, all the centers, they are privately run. Like Sabeen is doing an amazing job, and mashallah, this amazing lady sitting next to me, Sadaf. You know, all these institutes are run by private citizens. Government for the first time has, you know, made this school for autistic children. And as far as legislation is concerned, there are so many legislations which are there. You know, we have got signed so many pacts with UNESCO and all these international bodies that every child, even the Constitution of Pakistan says, every child should get, you know, equal opportunity in education. But the question arises, are we implementing those policies and what we keep talking in the assembly as far as the education ministry is concerned? So there's a lot of work which needs to be done to revamp the education system and make it more inclusive. You see, when the definitions, we need to work on the definitions. Like I told you earlier, we only know about regular schools, special schools. So what about these autistic, borderline autistic children who should be in regular schools, and they are there, but due to the lack of awareness, you know, like the owners of the school, because I've been visiting the private school and the government schools, when the people sitting at the helm of affairs in a school set up, they are totally unaware. And the autistic child is there, like I was telling you about this private school, and you know, the child was thumping, you know, that repetitive actions which they do, flapping of the arms, thumping his chest, and the mother was okay, although the mother was a doctor, but she was happy that the child got admission in a private school. You see, the policies, you know, from the government level should be check and balance. Not every person with money should open up a center. And then, you know, like trained staff, you know, not quacks. These days, you know, you pay $50, $100, you can become ABA specialist or remedial therapist. So from government side, it is very important that there should be strict check and balance, because we are dealing with human lives.
Definitely.
And the whole future of these children depend on the implementation of these policies. And what future holds for these children? Our examination system, our education system is so ancient that same, you know, like Mr. Chips, I read that in my school days, it's still there. I'm just giving you an example.
As well.
Yeah, I'm just giving you an example. Metric system does not, you know, is not helpful at all. In the that O levels, the British Council, they have a certificate for dyslexic children. If a child has some learning difficulty, you fill up that form and a child gets a lot of provisions, leverages, you know, a child gets a scribe.
Means there must have to be a government intervention into the different things. Then we have to check and balance on all these things so that we have, you must have a quality of education, not only for the all other students, but for the autistic individuals and the child as well. Definitely, no doubt about that. Sadaf, what are the most effective treatments for autism, and what are the goals of these interventions actually, especially when it comes to the behavioral and developmental therapies, the speech and communication, occupational or sensory integrations as well, cognitive, behavioral and the parental therapies, or it varies from case to case, or particularly when we are talking about, in a general sense, the role of medication. So, how do you see all these aspects when we are actually having the intervention related to an autistic child?
First of all, if we talk about the intervention after the diagnosis on proper assessment tools and proper clinical observations, and after the diagnosis, either it can be a level 1, level 2 and level 3, as Ms. Irum mentioned, mild, moderate and severe, we move towards the treatment, and the treatment only is the therapies. That is behavioral therapy, occupational therapy, dealing with the sensory deals of the needs of the child, and then speech and communication therapy that deals with the communication and alternative communication methods so that child can express themselves. And then when we talk about the behavior therapy, they will learn about the pre-speech skills and the daily functioning routine, independent functioning routine with the positive reinforcement, visuals, casuals. Ms. Sabeen also mentioned the strategies. And these are the intervention when we talk about. And then if we see that the child can read or write and having difficulty in that, then we will add up the remedial therapist to give his input in this matter too. And then when we talk about the medication, there is no particular medication we can say that this is the cure of autism. Okay. Yeah, we can use for the comorbidities that like ADHD, like some children with ASD are hyperactive and have irritability issues, anxiety issues, rigidity, sleep issues, gastrointestinal issues. We do deal with medications on that, but again we include the others medical professionals too. For example, if a child is having hyperactivity and meltdowns and the tantrums and self-injurious behavior, we send them to the psychiatrist to deal with this. If it is not recovering with the behavior therapy and the interventions we are providing to the child.
Okay. Your point well taken. Sabeen, how government and the policy makers can better support individuals with autism and their families by improving healthcare, education, employment, financial support and legal protections particularly? What are the particular autism support and specific policies and global practices that are actually implemented in Pakistan, whether there are any?
देखिए, as ma'am Irum mentioned, policies तो हैं. There are policies on inclusion. However, unfortunately, the government and the stakeholders are unable to enforce those policies. I have personally visited schools when children from my institution are ready for mainstreaming, and I've been told by the principals that our school policy does not admit children with autism. Why is that? That is illegal, but because there's no one from the government to enforce the inclusion policy, schools are able to do that. So first and foremost, the government needs to work with stakeholders and enforce the inclusion policy to make sure that every child has access to schooling. And as Ma'am Irum also mentioned, it's very unclear what inclusive education actually means. So awareness campaigns need to be run as to what inclusive education actually is and about autism, because very educated parents also come to me and say, okay, don't keep our neurotypical kids with these kids because they think autism is a disease that can be caught. So awareness is again very important. And of course, the autistic kids need legal protection. There are no laws right now protecting these kids, especially, God forbid, there's mistreatment happening in the home. I've met a parent who used to chain their autistic child at home because she didn't know how to handle the child. I've come across plenty of parents who are slapping their kids, unfortunately, because the government hasn't created awareness and the financial support is also not there. Therapies are expensive, schooling is expensive, the medical needs of these kids are expensive. And I don't know if you are aware of this, but autism is one of the most expensive disorders worldwide right now. So I would say the government needs to step up and help autistic families and individuals on all these multiple levels in order to create an inclusive society.
Definitely, you're very important point, and we have to do a lot really for the autistic child. Really, Ma'am Irum, what kind of education, training, and skills do the therapists, the psychologists, the teachers, social workers need to work effectively with the individuals with autism? What kind of specialized experience is required to have evidence-based interventions? Do you not think that the strong communication, observation or observational strategy, methodology, and problem-solving skills are actually inevitable when it comes to such responders?
Okay, let me tell you, ABA therapy is applied behavior analysis. Now, this is done if you want to deal with an autistic child. So not everybody can become an ABA therapist. Like I've done the course, I'm ABA therapist as well as remedial therapist, but my domain with dyslexic children is huge. So what you're saying is, the basic knowledge about multidisciplinary team. Like for different illnesses, you have different doctors.
Obviously.
First of all, the educationists, the school owners, the people sitting at the helm of affairs, they need to know that this multidisciplinary team of specialists, educational psychologists, clinical psychologists, and speech therapists, occupational therapists, ABA therapists, remedial therapists, this multidisciplinary team has to be on each school's panel, okay? Because I can't deal with all these
You
children.
need a very professional team when it comes to the autistic
Of course,
individuals.
so you need to take these therapists on board, especially in government schools. My heart goes out to these children. Due to the non-affordability and lack of awareness, it goes undiagnosed and these children suffer like anything. The abuse, emotional, psychological and physical starts from home, and it continues in the schools as well, because teacher is seeing a perfectly normal child. But then again, this repetitive behavior, they might think he's acting out. He's fine, he's acting out. I'm talking about borderline autistic children. You see, it's a spectrum disorder. So first of all, if anybody can do this, then like I told you, even the teachers training, which the government offers in government schools and all that, in B.Ed and M.Ed, the degrees, this should be, highlighted, and should be, a lot of emphasis needs to be put on the working of this multidisciplinary team. I did my B.Ed, I did my M.Ed, just a few plagiarized chapters, nothing at all. No practical, work was done by the university where I did it from. To how to deal, how to diagnose.
Your point well taken, because it is very important that we should have the professionals to deal with this issue, because otherwise it is going to be a worst case scenario. So, Sadaf, what is estimated prevalence of autism in Pakistan? As according to the Autism Society of Pakistan, estimates tell us that there are more than 350,000 of the children suffering from autism right now. While do the boys or girls suffer more from autism? An unofficial estimate, how it is more prevalent in boys as compared to the girls, because these figures tell us that more boys are actually suffering from this one. It's more under diagnostic issue. That is actually the real problem, because we have lots of family issues or the cultural anomalies. So that's why most of the people don't go and even don't consider that it's a kind of any sort of a problem or not.
This is a very important question, the prevalence of autism. It can also see us that how much awareness we do have in this domain. When we talk about the prevalence, as you mentioned, Autism Society of Pakistan recent data, according to 2023's 350,000 children are suffering from autism. But again, these are the diagnosed cases. We don't know about the backward areas where there are children suffering from these, and the parents even didn't know that what happened with this.
First, they don't know, and then might be they don't have any sort of a facility available to diagnose.
They don't know the exact diagnosis, what are the intervention, and why this child is like this, why he's different from other. So they basically send them to different madrasas, schools, and then they stop trying this and ask them to do the vocational things, or might be add them in the mechanic stores and all that. And when we talk about the prevalence of boys and girls, there are more boys than girls, 3:1 ratio according to the researches. But again, when we talk about the culture expectations and the societal expectations with the boys, and with that is already very difficult to understand. because researchers proved that the boys exhibit overt behaviors more than girls. So they can physically see the symptoms of the associated with the autism.
And it would be more difficult when it comes to the girls and all, because
exactly. They basically suppress their, mask their symptoms. So it is not difficult for the parents to. We do have females coming, girls coming in for the therapies, and we seen that they are more severe cases than the boys coming. If your boy is mild, they can send us to because they think that he's the bread earner of the house and he has to do that. But in the girls' cases, they just think that she has to go.
Your point
and all.
well taken. Miriam, are there any specialized degree courses or the certifications or credentials that the therapists, the psychologists, the counselors, teachers can obtain nationally, or internationally there are few available, or majority is internationally? So about national, at the national level, what's the situation right now, and particularly to demonstrate their real-time expertise in autism, and also what about the availability of such academic qualifications with our educational institutions, especially when it comes to the Pakistani universities and colleges, whether we have some courses available in academia?
You know, like from government point of view, if we look at that, majority of the institutions which I've come across are privately run institutions, and they are doing an amazing job. These amazing therapists, I mean, they're well qualified with good repute. That is the most important thing. You know, these days on social media, you pay $50, $100 and you can become a therapist. So again, the job of the government is very important. The onus lies on the government to ensure that they have got proper institutions, and especially these big universities, Allama Iqbal Open University and all. You know, they must offer these courses. Like I told you, ABA therapy is especially for autistic children.
Just like we actually regulate our dentists, our medical professionals,
there. Yes.
Definitely, and engineers even.
Yes, but why not for these multidisciplinary teams?
Definitely.
So there has to be some authority from the government. They have to take the onus and the responsibility to streamline the system. You see, when we face such a huge challenge that, you know, like parents come to us with their traumatic experiences, that I went to this therapist and she did this and she, you know, fleeced us. So when there is no check and balance, these, you know, 1 day or 2 day courses and few hours courses, and you become a therapist, and you belong to a privileged family and you open up your clinic. So when the international models are there, the check and balance, the certification, that is very important.
Definitely, your point well
Especially
taken.
when we talk about occupational therapy, there is a scarcity of professionals, OTs in Pakistan, because no university in Islamabad is offering OT. Only Peshawar University and the Karachi University, and then one university in Lahore.
OT means what do you
occupational therapy. Dealing with the sensory needs of the child.
Okay. Your point well taken. Sabeen, what role can community-based programs and the service play in supporting individuals with autism? Their social inclusion, the skill development, and overall well-being, how much they are critical in bridging the gap between the clinical interventions and the daily life?
I personally feel that community-based programs are very important, because therapy is one thing, but then we have to help the kids. What they learn in therapy, it has to be generalized across settings. So to generalize the skills they have learned, community-based programs are very important. I'll just give you a small example. If I am teaching a child to play football, for example, a sport, in my one-on-one therapy sessions, until and unless that child does not have access to community-based sports like a football club, the child will never be able to generalize the skill he's learned with me in a one-on-one setting. So in order to help the autistic kids generalize their skills, I think community-based programs are very, very important, and I don't think we have any of them. If at all, there are very few here in Pakistan, and we definitely need more of those. Also, not just to help generalize the skills, but again, to build this inclusion, because inclusion comes, I'll just tell you something. Autistic children, as adults, we put this fear in children of autistic children. I've seen so many neurotypical children interact with autistic children, and they find no difference. In fact, they help them out. So community-based programs will help the next generation include autistic children in society. So I think community-based programs are
Definitely.
key.
Your point well taken, Sabeen, your point well taken. When we are talking about particularly on the aspects of different reports, that is it genetic predisposition or maternal infection or primary cases primary cause of development of autism is because of the environmental influences, like you have pollutions or smog or something like that. So, or it is the combination of all. What is the primary cause of it really?
This is very important question. We should know the causes of autism so that we cannot put the blame game. Like some parents come to us and they blame the mothers for putting the child on the screen all the time and having all the duty of household. That's why she put them on the screen and it causes autism. Yeah, we do have environmental factors that is also in the screen time, the maternal age and the toxins and the trauma related to the pregnancies and the stress during the pregnancies, the food we are eating, the screen we are taking, the environment we are having. But again, it is the combination, both
Definitely.
the genes and the environment.
Your point well taken, because we have run short of time. So, Ma'am Irum, a very short and brief. How can we promote the great awareness, really greater awareness, acceptance and inclusion of autistic individuals in society, particularly when we are talking about the mainstream media, the social media, all other tools to have awareness, our cultural and the religious campaigns, those are very important, then the community and society as well. So earlier when I was using some words, you have intervened, the normal, schools, or when we are talking about symptoms. So these words not to be used. So whether ever we have thought about that the training for the media professionals and capacity building of those who are involved in that to spread real-time awareness and avoid all those jargons who are creating some sort of a mayhem, particularly for the children who are suffering from it.
First of all, hats off to you for arranging this program and spreading awareness. This is what needs to be done by all the social media, all the media houses, these private channels. Then again, onus is on the government. What is their priority? Okay, these neglected lot, the children who are suffering like anything, the whole family suffers.
Definitely.
So it is very important using the right terminology. You see, mashallah, you're an educated person. I'm sure you must have done research on this program before, but you didn't know not to use.
Actually,
yes.
prior to that, I know nothing. But when this topic was decided by me, actually, so I have tried my level best to have something on that, and I have studied all the way through that what it is and how we have to.
Yes, the whole society needs to join hands. You know, whatever capacity they are working in to make Pakistan autism friendly.
Obviously.
First of all, we need to know what it is. It is not an illness. It is not a mental disorder. So let's learn about autism. And each organization, again, the government is responsible for enforcing this on all the organizations.
Very right,
yes.
very right.
Okay.
Your point well taken. Thank you very much for being with us, Ma'am Irum. Thank you very much, Sadaf, for being here in the studios. And thank you very much, Sabeen, for being online and have very candid and elaborative views. Thank you very much for participation. Viewers, as just listen to our very honorable participants, it is very important to understand that autism is a kind of a condition. It's not a disease, it's not an illness, not a mental type of situation, but we have to deal the children with autism as a special one, because these are a bit different from others, and we have not ever, and we don't have to be much in stress when it comes to the family or the caregivers or the teachers or the therapists, because we have to be we have to understand that these are the children which needs more care rather than the others. Other children also needs that, but these are the children which needs more than that, and we have to behave like normal human and when we are dealing with such type of cases. But the diagnostic is very important. We have to spread awareness for that. And media, social media, along with the government entities, the state institutions, all can play a vital role, because we have to change the curriculum as well. We have to put more emphasis on our school and the educational institutions, the workplaces, and we have to have some sort of an atmosphere over there where the autistic individuals or children or young people can work freely with independent minds. And when we do that, and it is ensured that it would be a very beneficial for whole of the nation. So the important thing is that Punjab has taken a lead with one of the school opened there, but we have to do more on that. This is just a little intervention. We have to do a lot, really. There must have to be an authority which must check the health interventions into the autism. Second is the educational institutions and certification, the degrees and all that. That must have to be certified so that the quacks not get any sort of a benefit out of the monetary benefit, obviously, out of this whole exercise, because it's going to be a very important service to the nation. So autistic individuals are Pakistanis. They are the people who can lead the country. So we have to put emphasis upon them, and autism is an important factor. If we deal with it, we can have no children with that. And it is going to be an exception for Pakistan in future. So this is all from today's Foresight. It's time to sign off. Allah Hafiz.